Well, welcome to the Aging Boomers. I'm your host, Frank Sampson. Of course, on our show, we discuss so many of the issues facing boomers, their parents, and what we know as an aging population, which I am certainly part of. And I just want to thank everybody for all their great input. We're getting a lot of great input on our show, and just thank you for taking the time of listening and sharing our information with friends and family. A lot of great information that we discuss on our show. For those of you that don't realize, you could listen to the show via iTunes, iHeartRadio. Also, we have a free download that you could app on your iPhone, Android phone. Just type in the Aging Boomers and download it and keep up to date. You could also go to our website, of course, at agingboomers.com. So I want to just let everybody know that today's show is sponsored by Senior Care Authority, a professional senior placement and elder care consulting organization that has a national network of advisors to help in determining the right path for senior living and receiving proper care. So whether it's in-home care, assisted living, residential or memory care, or you just need an advocate to help you through navigating through our healthcare system, you can get the necessary advice from a senior care advisor in your area by calling Senior Care Authority at 888-809-1231, or you could go directly to the website at www.seniorcareauthority.com. So, as I always start out saying, I'm always excited about our guests because I learned so much, and that's the purpose of our show, The Aging Boomers. So I'd like to introduce Dr. Sonia Mosch, who is a board-certified clinical neuropsychologist, working in the Twin Cities in the Minneapolis-St. Paul area for the past 15 years doing diagnosis and treatment of dementia. In addition to dementia, her specialties include MS, Parkinson's disease, concussion, and sports performance psychology. Dr. Mosch works at Neurological Clinic, one of the largest neurology practices in the Midwest, and she also has a private practice, Positive Neuropsychology, PLLC. So, Dr. Mosch, may I call you Sonia?
Yes, please do, Frank.
Perfect. So, Sonia, welcome to the Aging Boomers, and thanks for joining us today.
Thank you for having me.
Yeah, so, neuropsychology, all right? It's maybe a term that, some people understand, but I would say most don't. So tell me what you mean by it, first of all, and then certainly tell us in terms of the work you do, what do you really specialize in more specifically?
Sure, I'd be glad to. So neuropsychologists are typically clinical psychologists who have an expertise in the brain. So our job really is to use paper and pencil types of tests to measure brain function. And when we do that, we can get a pretty good sense of different patterns of strengths and weaknesses being correlated with certain diagnoses. So it's really a diagnostic tool to try to help clarify, when a patient or a family member is concerned about somebody's thinking skills. This is a way to measure that very objectively and get a very good sense of essentially tapping into different parts of the brain and measuring how it's working. So we use it as a diagnostic tool to try to help clarify what's going on and what's causing these issues.
And I would think, though, I know you work with all different types of issues, but with with what's going on in the aging population, I have to believe that your practice has grown with the elderly and helping to diagnose maybe certain cognitive issues. Is that correct?
Yes, Yes, that's it. That's very correct. It's actually difficult to keep up with the referrals in some senses, but one of the bigger questions that we get asked is, hey, is this just getting older? Is this just a senior moment, or is this something that's more indicative of a memory disorder that requires some kind of treatment and some planning for the future? So that's really what neuropsych testing is designed to answer, is that question of, is this normal aging or is this something else? So yeah, it's a growing population, and it's fun work, but it's a bit hard to keep up sometimes.
Yeah. Well, so what do you suggest to those families who have a loved one that they're trying to, there might be self-diagnosing that, based on all the signs, based on everything that they've read, they go, I think my mom for sure has dementia. So the fact that she does and there's no cure, why have her tested? What do you say to people that think that way?
Yeah. Gosh, that's a great question. Well, first of all, I would say, it's not mandatory, and I don't like twisting anybody's arm about participating in this kind of process because, we just need to respect the dignity of our elders, and if they absolutely don't want to go through it, I'm certainly not going to, try to cajole someone into doing it. But I do think there are benefits to knowing what's going on, and I think it helps the families in particular be able to plan for the future. So if we get somebody in for testing and find out, hey, this is just normal aging combined with undiagnosed and untreated depression, well, that's a very treatable situation, and we get the person on the right kinds of medications and, doing pleasurable activities that bring them joy and, do some behavioral techniques, and that person's functioning much better versus somebody the same age who comes in and it looks like, gee, this is really a pattern that suggests an Alzheimer's type dementia process. The family can benefit from knowing that information because it has implications for what things are going to look like in a year, in 2 years. How much help will this person need? What things are they going to have to modify? What about driving? What about taking medications? And what about memory medicines? Maybe the neurologist is going to want to consider giving a memory medication. So it has implications for how are we going to help the family go forward in the future. And it's very often the case that the person with the memory issue is not aware that they have it. It's the family who's saying, gee, Dad, I really think it would be helpful for you to come in and do this test. And, maybe the elderly father might begrudgingly participate, or maybe, happily participate. That's great. But also just to help families know that they're not alone. It's not uncommon at all for patients to not want to go in and see umpteen doctors and have testing and, I don't know. That's a long-winded answer to your question, Frank.
Right.
Sorry, I hope I answered the question.
It's a good answer. So, the fact is, I know this, but maybe you could expound upon it, is, Alzheimer's is a form of dementia that is probably, is the most common type of dementia that's diagnosed. But there are types of dementia that are reversible. Correct. So somebody could have some form of dementia that is reversible, even though it's less common. I understand, but it's another reason probably to go in and get tested. Am I right?
Yeah. Yes, you're right. Absolutely. It is statistically less likely to be a reversible dementia, but for example, if you've heard the term normal pressure hydrocephalus, or what's sometimes called water on the brain, that is a reversible problem with the right type of surgical procedure. Other things that are helpful to know is if the dementia is due to multiple strokes and is considered a vascular dementia as opposed to an Alzheimer's dementia, although we can't reverse that, we can get really proactive and aggressive with stroke risk factors at that point and stop the process from getting any worse from where it is. So that's also another reason to know, gee, is this a vascular process versus Alzheimer's? That's an important distinction to make in terms of, wow, this person's stroke risk factors are really something we need to take a look at and get real careful about.
So what could somebody expect if they came in to be tested for concern, let's say, was dementia? Is it really you sitting down, talking, asking questions? Are there scans that are done? What's kind of, generally speaking, what should someone expect?
Sure. So typically, every neuropsychologist might have a different process, but in my practice, typically what would happen is I would chat with the patient, and if they're okay with it, invite the family to join us for this first part and chat about their background, learn about, their educational history, what they did for work, etc., so to get a sense of where their baseline is, and then ask some questions about what the patient's perceiving as symptoms versus what the family is seeing and noticing. And that process might take anywhere from, 30 minutes to 60 minutes. And then the next process is I would meet with a technician, my assistant, who would go through the formal testing with them. And that process might take anywhere from an hour to 2, possibly more hours. And that process is where the patient is one-on-one with the technician, and they're answering questions like, for example, I'm going to read you a list of 10 words. I want you to listen carefully, and when I'm done, tell them back to me. And so then they'd read that list of words. Then he'd read it again a few more times because we're measuring their learning curve. And then we'd go back 20 minutes later and say, remember those words? Can you come up with any of those now? So that's an example of the type of testing that would be done. And then they would meet with the technician for maybe an hour to 2+ hours and work on those brain skills types of measures, and then I'd have some results in a couple weeks and sit down with them and go over what this means.
So the work that neuropsychologists do like that, I would think there's some sort of statistics in saying how often were they correct. I mean, because you hear that, especially, a lot of the talk with concussions and football players ending up with some form of dementia. They say, well, until they test the brain after the particular person passes, they can't know for sure. Okay, so how accurate is this? Is this type of testing?
Oh, well, these are great questions, Frank. So in terms of diagnosing somebody with dementia, the current state of the science is that a standard MRI scan really is not that sensitive at picking up Alzheimer's disease by looking at a brain scan. So measuring brain function rather than structure with neuropsychological tests tends to be, the gold standard, or considered more sensitive and specific for diagnosing cognitive impairment. So we're pretty accurate. So in our clinic, for example, there are neurologists who would order laboratory studies to look for, are there any vitamin deficiencies or metabolic insufficiencies, order the brain scan to see, is there anything structurally that looks to be an explanation, and then order the neuropsychological assessment, which is often the diagnostic tool where they're able to say, okay, everything else is negative. The only thing that picks up a dementia in this case is the neuropsych testing.
Got it. Okay. It gets complicated, that's for sure. But
it does.
Yeah. So I know you do some work that's called design psychology. Tell us more about what that means. Yes.
Well, it's kind of a new-ish field, and it's using what we know about psychological science and applying it to designing environments. So it hasn't been done too much, in terms of you're not going to be able to look in the phone book and find 12 design psychologists. It's not, it's pretty new. But the way it's interesting in terms of how it can be applied to somebody with dementia is that different types of dementias can present with different symptoms that can be challenging in the home environment or in the assisted living environment or wherever they are. So having someone look at the specific diagnosis and how that impacts how somebody uses the space can be helpful to say, gee, in this particular type of dementia, say a Lewy body dementia, somebody is prone to hallucinations, seeing things that aren't there. In those types of situations, it's critical that they have a very, very well-lit space because lighting can affect how easily people misperceive things. So that's an example of how knowing something about the diagnosis and the specific symptoms that somebody might have can help guide things like lighting, wayfinding, choices for textures and colors, etc.
Very interesting. Very interesting. So I know that if it's okay if I say this, I mean, one of your, I guess, clients is the Wild, right? The Minnesota Wild, some of the players there.
Yep.
So
the NHL.
Yeah, the NHL. So I know that, all right, I shouldn't say that I'm from Detroit. I'm a Red Wings fan, but it's okay.
Okay, we'll still be friends, Frank,
we'll
okay?
We'll still be friends, okay. So sports psychology, concussions that are going on, there's just so much talk about this, especially in football. I mean, I've got 2 grandsons, and I tell my son, I don't want them playing football. All right? I just don't have them play football. Do you think I'm crazy or not?
I don't think
I'm
you're
really
crazy
putting you on the spot,
all.
aren't I? I'm putting you on the spot.
No, don't. I'm happy to answer this question because, you can't take 2 steps into the internet and not read something about this. So I'm glad you asked about it. So first of all, I have a little hockey player who's actually not little. He's taller than me now. And I'm perfectly happy to support him continuing to play hockey. And so I want to also say that I think that I don't know specifics about what the NFL concussion program is because I'm not involved with the NFL, but so as I can tell you what I know about the NHL is extremely careful and proactive about player safety. So it's been a joy to work with them. I'm really impressed with how careful they are with the players. And there's a strict protocol that is in place with every single team, no matter where you are, if you're in Canada or wherever. Now, I think what you're referring to maybe is CTE, chronic traumatic encephalopathy. Is that where you're going with that question?
I think so. I didn't remember that term, but I think so, yes.
Yeah. So the thing is, folks with multiple concussions who are showing up later as CTE, what we know about the science behind that is that there is not a definitive established link that the scientific community is in agreement on. What the scientific community is in agreement on is that we need to study this better. And one of the problems is that we need to have really good control subjects. So in some of the studies where the rates of Alzheimer's disease in professional football players is examined, when you age match the controls, the rates are actually not any different. So we know that there's something here, and it's generally not a great idea to bonk your head really hard multiple times. Everybody knows that piece, but we're not entirely sure as a scientific community that there's an agreement on multiple concussions leads to XYZ disorder, and it's an inevitable causal link. So what typically happens is that most people recover well from a concussion within 7 to 10 days, and there is a little period where they're a little more vulnerable. So that's why we want to keep people from playing a sport within the first, couple of days after they've been concussed, because it's not good to be concussed and then get hit again within that vulnerable period.
Right.
So keeping people out of their game for maybe a week or so, that's a great, safe idea. But we don't know as a scientific community that there's a definitive link there. So me as a, super protective hockey mom, I'd be the first to pull my kid out of the sport if I thought he was ruining his brain. And I'm, at this point, just making sure he's got proper equipment and that he's got good coaches who, have good training and so forth. And I'm trying to support that. So I don't know if that helps you with your grandchildren.
No,
sports.
It does. I guess, you play that type of sport, you can't absolutely ensure that a concussion is not going to happen. But I guess what you're saying, all right, I'll put it into a different term. If somebody has does have a concussion, as long as they kind of take care of that, they don't play, they stay away from playing so they don't get a concussion again during that time, during that recovery period, there's far less likelihood of any long-term problem. Though, again, it's not...
Exactly.
Is that right? Okay.
That's exactly right. Okay. And the other thing I should just, now that you've raised this issue, is I see this a lot with kids, especially who are told after a concussion they need to lay in a dark room with, absolutely no brain stimulation for a week or 2 weeks, or, the thing that's a little concerning about that is kids can develop depression pretty quickly after an injury if you tell them to go lay in a dark room and have no human contact with their friends on their phone. So, or they're, Snapchatting or whatever they're doing. But I think it's important to allow anybody who's had a concussive injury to engage in safe, pleasurable activities with the world around them, because we don't want somebody to be isolated and essentially send them to go live in a dark room for a month and not expect them to get depressed. I mean, that sounds depressing to me. So it's important, yes, keep them out of their sport so they can heal their brain, but, let them have a little of what makes them them, if that makes any sense.
Yeah, it makes perfect sense. So, the types of thing we've been talking about is more reactive situations. Somebody comes to you because their mother or father has been, their short-term memories going, different things are happening, and they want to get tested. Somebody has a concussion, or they think they have a concussion, they come in and get tested. What about proactively? I mean, have you had people, or do you recommend that people come? They have nothing's wrong, but maybe there's some testing that could be done to help them in their overall health. Can we talk about that?
Sure, yeah. It's sometimes people come in and say, I want to get a baseline. I want you to measure where I'm at now. I'm not having any particular symptoms, but I want to know if I feel like I'm kind of foggy in about 5 years, and I want to know if I can compare this. That's a pretty smart, proactive way to do things. And really the only limitation to doing it that way is a practical one, because a lot of insurance companies don't reimburse for a neuropsychological exam that's preventative. It's typically not something that an insurance company would pay for.
Right.
And if folks are willing to, not use their plan or use their, health savings account or some, pay for it in another means, that's certainly a good proactive thing to do. It's not necessary. So if somebody feels like, oh gosh, I just can't get a baseline, and, am I in big trouble? Not a bit. I mean, that's what neuropsychologists are trained to do. We're trained to evaluate somebody without having a baseline. That's what our specialty is. So it's nice to have it, and we can also use that information to give some suggestions about, brain healthy lifestyle choices if they're not currently engaging in those. So it's nice to have, not necessary.
Got it. Okay, good. Well, this has been very educational. I want to make sure that I'm sure we have listeners that would love to learn more about what you're doing and your practice is doing. So why don't you just share any information you'd like to share, websites, if you want to share a phone number, whatever. Go ahead.
Absolutely.
It's commercial time.
So, okay. Well, my private practice is positiveneuro.com. So it's just how it sounds, positiveneuro, all one word, .com. And the design psychology website is therapeuticdesign.com. So just exactly how that sounds, no spaces, therapeuticdesign.com. And the clinic, the multidisciplinary neurology group where I work is Noran, Noran, noranclinic.com. So any of those would give you some information about, neuropsychological testing, what some of the sessions are that could be available, or how it might help you or your family or your elderly parents, etc. So I'm happy to answer questions. And you can also email me at sonia@positiveneuro.com.
Well, Dr. Sonia Mosch, thank you so much for joining us. Wealth of information. Love to have you back in the future. Please reach out to us. I'm sure as things change, which they do so often, and your end of work, we'd like to be kept informed, so we'd love to have you back.
I would love to be back. Thank you so much for having me, Frank.
Well, thank you. And again, thank you all for joining us on the Aging Boomers. Just be safe out there, and we'll talk to you all soon.